You're listening to 90.3 WHPC, the voice of Nassau Community College in Garden City, New York. I'm Bill McIntyre here with Jon Gallo, bringing you news stories about Long Island and about Long Islanders. We would like to welcome to our show the Nassau County Executive, Laura Curran.
Nice to be with you again.
Yeah, we're gonna save you a chair,
virtual chair,
so you can just come in anytime and sit in.
Well, there's a lot of news, and
I love it.
Things change fast, and I know we talked to you towards the beginning of the school year when we first kind of came back to our regular broadcast schedule here, and we know that thankfully we were making a lot of progress, and things were pretty calm. And you had done a lot of good work with a lot of your colleagues at the county level, at the state, and all of our federal delegation, trying to work together to keep Long Island safe and keep us all kind of thriving and moving in the right direction with COVID. And it's been that way for a while. But as we've seen, and obviously the elephant in the room is, as you've been discussing this week, that it looks like the infection rate has increased. We've been about 3% or higher this whole week, essentially, for the last few days. So I guess if you can give us an update on where you see things and what your office is doing again to keep people confident and secure and going through the next weeks and holidays as we progress.
Yeah, thank you so much for that question, John. We really are at a very strange point right now. The last time we spoke, it was right before school started. School, we had some outbreaks in colleges and things like that, but by and large, our school buildings, K-12, and even in colleges and universities, when you're in actual school, in the actual buildings, that's not where we're seeing a lot of outbreak. The schools have done such a good job, as have our colleges and universities, in putting cohorts together, pods together, in making sure that there's masks, there's social distancing, rearranging the whole schedule, et cetera, et cetera.
Yep.
Same with businesses. We're not seeing, I know at the beginning of the pandemic, before we really knew anything, they were seeing spread in restaurants and gyms and bowling alleys. We're not seeing that now. And I had advocated for gyms and malls and bowling alleys to be able to open because I saw for myself what they had put in place. And I felt very confident they could reopen safely. And by and large, they have. We're really not seeing much virus spread activity in those kinds of establishments. However, fast forward, here we are, right before Thanksgiving. And you're right, our rate has been over 3% for about 4 days now, 5 days now. We had been at 1.5 or below for months, for the summer months. And our hospitalization rates, we're at over 100 now. Now, mind you, at our peak, we were at about 2,500. So being over 100 is not the end of the world. However, we had been down as low as 25. So obviously it's going in the right direction. So why is this happening? If everyone's doing everything right, why is this happening? It's because people want to have these social gatherings, whether it's birthday parties, sweet 16s, off-campus college parties. We also get reports of people who are having big, fat weddings, 203 people weddings. Our fire marshal has, unfortunately had to go and break some up. But we're also getting reports where people were traveling to other states that had higher capacity to have their big, fat wedding there. People get sick, they come back, our rates go up. So then here we are now where we're seeing our businesses, our gyms, our restaurants and bars now having restrictions, even though they'd been doing everything right. They'd been playing by the rules. But because people were insisting on having these social gatherings, they have to suffer, which really breaks my heart. We try to support businesses as much as possible with loans and PPE and advocating for their safe reopening. And to see that the hit that they took and the changes they made, I mean, my goodness, you go into one of these restaurants or gyms or whatever, it's pristine. The way they have the partitioning, the spacing, everything's sanitized, everyone's wearing a mask, obviously, unless you're putting food or drinks in your mouth. So this is where we are right now. So, and as I said, we're right on the cusp of Thanksgiving. And then you have this kind of interesting new rule from Albany saying only 10 people can be in a home. Now I'm getting a lot of feedback from our residents saying, are you kidding me?
I'll bet.
How are you going to enforce that?
Exactly.
What are you doing? Although I got to tell you, some people are thinking, "Oh, thank you. Please thank the governor for us because we didn't want to be with that side of the family anyway." So this gives us an excuse.
Yeah, just quick zoom in and out.
Yeah.
Oh, that's funny.
But yeah, it's a lot. Like you said, that's been changing. Go ahead, though.
The bottom line is the governor has been saying this all along, that we're down to a certain percentage, and we were cruising along there pretty good for a while. And he said as soon as that number goes up appreciably, which I think it did, he's going to pull the reins back on our ability to go out and mingle, I guess, So nobody should be
right.
Yeah, nobody should be surprised.
The concern of the lagging indicators and leading indicators, definitely is something that's pressing. And I know, like you said, seeing that thankfully we're not where we were, but being fully prepared.
It's not getting better. It's not getting better. That number's
But you're right,
bigger.
though. The governor has been absolutely clear that he's going to keep looking at the numbers and then recalibrate, turn the dial, turn the valve one way or the other to get some control over this. Now, I would argue that our residents, our businesses have been fantastic. But as I say, it's these gatherings, and it's just a shame that they have to suffer when they've been doing the right thing because people want to have these gatherings. And my pitch to people who were like, I get COVID fatigue. I completely understand not wanting the restrictions and wanting to gather and have proper weddings and birthday parties and all of that. So my argument to them was, look, if not for yourself and for your family, if you're not worried, and that, some people just aren't, that's fine. But think about the businesses and think about your downtown and think about economic revitalization and think about kids. Kids, young people need to be in school. I have kids in school myself. They need to be in a social environment with their peer group, in a structured environment is healthy for their development. Forget scholastic development. Yes, obviously incredibly important for that, but for their emotional development, for their social development. And, for being, kids need to feel like they belong to a group. When they're stuck at home, they don't have that. So do it for them. That was my pitch.
Yeah. Makes a lot of sense. And thankfully, like you said, for the most part, even in New York City, the testing rate of who was showing up infected in, Long Island and Nassau schools is relatively low for the amount of people who were involved with that. But it looks like, am I correct, one school district, at least as of this week, announced that they will be closing for the rest of the school year. Is it Roslyn, I believe? After I know there were some cluster sites in the Great Neck area and also in the 5 towns. You maybe want to speak a little bit more about both schools and maybe those cluster sites and what, again, we're doing to help them support the needs over there?
Right. So we have 56 independent school districts. They all have their own various protocols and dealing with coronavirus and various rules. And some have decided to shut down for a period of time. Some, maybe for a day, some maybe for a couple of weeks, some not at all. In my school district, my kids are in the Baldwin School District. There have been a few cases, not many, but there have been a few cases scattered in the buildings. And it's structured in such a way that the cohort will quarantine, but the whole school doesn't have to shut down. So that's one way of doing it as well. We've seen, because of these activities that are happening not in the building, we are seeing some districts making the decision to shut for a limited period of time. So our health department is in constant communication with our superintendents, with our school districts. We will support their decision. We trust them to make the right decision for their students and for their staff. And we'll support them in any way that we can, and answering their questions, clarifying, et cetera.
Of course. But I think also just it may be easier to do. I know you've spoken about this in the past. Contact tracing in environments like that, where it's more structured, like a school, where the employees have to maybe do it as part of their requirements, and the students and the parents. But like these other events, like you said, whether they're weddings or whether they're Halloween parties. I know it must be a massive undertaking to try to convince folks, who already are doing something that's kind of not maybe, completely above board for where we're supposed to be doing, to participate and to get them to be willing to give you the information so that we can follow that along. Do you want to speak a little bit more about that again, and why maybe that's a big part of it too, and why we're seeing those kind of super spreader type events?
Yeah, that's a very good question. When our contact tracers call, oftentimes they'll get cooperation, but sometimes not so much. Sometimes people don't trust it. And my message out to the wide world out there is, if you get called by one of our health department people, they're not going to blame you. They're not going to shame you. They're not judging you. Their only goal is to contain the spread. And these folks have been doing this work for decades, whether it's HIV or meningitis or E. coli or whatever. Their goal is to contain the disease and to slow and or stop the spread. So they'll never ask you for Social Security information, delicate medical information, banking information, financial. They won't ask you any of that. So, if there are scammers out there trying to do that, that's just hang up the phone, call 911.
Yep.
Our guys will call you. They'll identify themselves as Department of Health, and they will ask you a series of questions. And the goal is to contain it, to stop the spread, to slow the spread. Not everyone is super cooperative. A lot of people are, but some people, for whatever reason, don't want to help us. And I'll say it again, if not for yourself, for your family, even for your community, think about the businesses. Think about what happens at the state level when the valve is adjusted, what that means for our overall economy, what it means for people not working, what it means for children's mental health. Heck, everybody's mental health. Nobody likes being isolated. We're social humans. We're social creatures.
Yeah.
So it just helps us contain so that we can finally get back to some kind of normal.
Yep, of course. That's what we all want.
Now, we talk about, of course, we always use the numbers for the cases. How are we at hospitalizations at this point in time?
So we're at about, the rough number is about 112 right now. It was yesterday's numbers. Now, remember, we were down in the 20s at our lowest point in August. But we were also at 2,500 at our highest point. So, 112 versus 2,500. Definitely higher than we've been, but much, much lower than at our worst. Maybe that's not the best, and now maybe that's not the best comparison, but the numbers are going quickly.
Of course.
The good news.
It's a good point, though. If we pinch it now, we could stop it. We may not get anywhere near 2,500. That would be a good thing.
That's exactly right.
Sorry, cut you off.
It's not a reason. Oh, no, that's quite all right. It's not a reason to panic, but it is a reason. It is a wake-up call. And I was just going to say, Bill, the good news is that on ventilators, it's about 10. So we're very, people getting very sick in the hospital on ventilators. We're not anywhere near where we were when we were at 500.
Yeah, and now we have the infrastructure in place, too, a bit more, obviously.
I would love to be able to pound into people's heads the idea that, we've all done that thing of comparing it to the 1918 pandemic. And when people say a number like 50 million, everybody gets that impression, oh, well, this isn't that. But if we have these, what they would consider small numbers, if we have them for any protracted amount of time, we could be looking at those numbers eventually as though this thing will never go away.
Right. And it has been so unpredictable, and the fact that it's still here. However, we know how to mitigate the risk. I mean, this is something I've been talking about forever. We know that wearing a face mask is I don't like it. I hate wearing those things, but it does stop the spread.
Yeah,
it does. Or at least, there's absolutely no such thing as zero risk. We know that, but it definitely reduces the risk. We know that social distancing works. We know, not breathing on people and talking up in their face works. It's simple. Yeah. It's not complicated. It's simple stuff. I mean, I'm just going to use myself as an example. So I've been out and about the entire time, talking to people, doing things, having meetings, blah, blah, blah. But I always try to be as careful as I can with the mask. I had a COVID test yesterday. It was negative. Every test I've ever had has been negative. I don't know. It's not scientific, but it does show being out and about, you can protect yourself. I mean, there was a really interesting statistic early on, and really in the height of it, where 83% of people in the hospital with COVID, so people who'd been hospitalized with COVID, 83% had been homebound, had been in lockdown at home. So they were getting it from family members or whatever. But the bottom line is only 17% were people who were out working, who were those, workers who had to be out there, healthcare workers, grocery store, et cetera. They were protecting themselves. It shows that these very simple measures really do work.
Exactly. Right. I think, like we said before with the schools, where you can have the policy be, kind of given, and it's very clear, and, it's really supported. It's good to see, like with the MTA workers, Long Island Railroad, that, people were very concerned about that risk of spread. But as we saw, thankfully, in proportion to the workforce, the rates, relatively stabilized and became lower, even though there were a lot of people who were impacted early on. Let's just remind listeners that they are listening to This Week Long Island News, and we are here with Nassau County Executive Laura Curran, and we're obviously speaking about COVID and where it kind of has been and where it is at the moment and potentially could be. I guess, that kind of segued into the concept of the vaccine kind of conversation and the distribution plans that I'm sure, your office, along again, like we said, with the other state and the elected officials are kind of discussing for when we do see that it's open to the public, and we have seen progress in this week specifically, I know with the Pfizer vaccine and with a couple of others that have been out in the press. What is that discussion like right now, knowing that, again, hopefully that's where we're going and that really can be maybe if not the silver bullet, but something that can really make a major impact in getting us to where we need to be going forward.
Yeah, that was great news about the Pfizer vaccine. There are other vaccines that look like they're getting close. It's wonderful, wonderful news. I am very much looking forward to it. It's going to be quite an operation. The Pfizer one, for instance, you have to have 20, I think it's about 3 weeks apart. It has to be stored at 80 degrees below 0 Celsius, which, I know that hospitals are rushing to get the equipment to get that kind of cold condition. It's going to be quite an operation. It's going to be like a military style operation to get this distributed, to keep track, have to prioritize, whether it's the healthcare workers, the vulnerable, whatever, however it decides that it's prioritized, that has to happen. But we are watching it very closely. I've been speaking with my health commissioner about, and he's been we're also speaking with the state about possible strategy and how to get this as efficiently, effectively, and safely as possible to as many people as possible. You're also going to have the issue that some people won't trust it. So there's that. You can't make anyone take it, obviously. So that's the trust issue will have to be discussed and hopefully overcome.
Yeah. I think that's a. Personally, I feel that the national politics is filtering down to this, and that's why you get that attitude. Same goes true for the contact tracing. There are just some people who have lost confidence in all the democratic institutions that we all, put our stock in. And so it's going to filter down to this. And this is the worst time that this could happen.
Hopefully, that it's proven to be, it's validated, it's safe, and enough people trust it that enough of a percentage gets it that we can really get a handle on this thing.
Of course. And then that was actually a good segue to maybe just one of the last topics, just real quick, that we want to discuss in terms of instilling that confidence in our democratic institutions. There's no more, kind of apropos or direct example as in the elections. And we obviously just had our elections out here on Long Island. And, we maybe just want to get your comments on, the Nassau County BOE process. I was just saying to Bill here and other colleagues that I've actually been at Citi Field involved with the Queens BOE poll watching process. And, it's been really great just to see, again, how hard those poll workers are working and all the different precautions that they're taking to keep themselves and everyone safe, but also to make sure that everything is done, perfectly, as it can be to make sure all the votes are counted and everyone's voice, is registered. So if you just want to speak maybe briefly just about where Nassau County BOE is taking on that challenge of absentee ballot processing, which is different than it's ever been.
Yeah, sure. So in Nassau County, they start counting the absentee ballots about 10 days. So they started yesterday, 10 days after Election Day. So we had a lot of races where it looks like maybe someone lost, but maybe they're going to end up winning.
Yep.
And obviously vice versa. So they're counting now. And the thing that gives me a lot of trust in our system, the New York State system and in Nassau County, is that there's very little room for shenanigans. You have the same amount of Republicans as Democrats doing the work, whatever that work is, whether it's community outreach or whatever. And also when it comes to ballot counting, you have the same number of people at the table. So no one can pull a fast one. So I'm confident that at the end of the day, when the counting's done, and there's a lot more to count this year because of COVID, because a lot of people absentee voted, that we're going to have a fair number. And the point is, you want to make sure that whoever it is, whether it's the Republican or the Democrat, that they're the ones that the people chose. They're the majority, put their trust in that candidate, and that person wins.
Definitely. So, yeah, it's great to see, again, how that actually works. And, like I said, what's being done Because sometimes people just think, oh, the vote's cast and it just ended, it just goes to the machine. But with these absentee ballots, there are, real live humans, and they're putting in their day's work, making sure that your vote is counted and everything is above board. Like you said, lawyers are involved, and everyone's making sure everything is nice and as straightforward as it can be. So, okay, thank you again for joining us. Maybe just the last thing, I know tonight there were some new orders that were going to go in place in terms of facilities closing at 10 o'clock. Could you just maybe leave us with, again, just your quick thoughts on that and what actually those policies mean tonight going forward that are taking place?
I know our restaurants and bars are working hard to make sure that they can accommodate the new restrictions. I know that they're gonna take a hit. I want to support them as much as I can. We do have some money for loans for small businesses. If there are any businesses out there who were passed over for PPP, or even if they got PPP, now they can apply. Go to boostnassau.net. We're also going to be announcing next week a grant. So it's not a loan, it's a grant for businesses to help them get over the hump. So stay tuned. We'll be announcing more on that next.
Yeah, that's an important one. A lot of the people were, because businesses, the feedback that I've gotten is, one guy was saying, I spent thousands of dollars to redo the inside of my establishment with plexiglass. And now I'm being told I can't stay open till I can only have 10 people in my, I don't know what to do. So, his contention was, if it was safe then, why is it unsafe now? After
the word that we heard so much about these restrictions is arbitrary. That's a word I'm hearing a lot now, especially with these folks who had been doing it right. And as you say, Bill, had been invested thousands of dollars in infrastructure and measures, and my heart breaks for them. This is not easy.
Of course.
Well, that's why it's good to hear about the financial incentive, at least if they can go someplace. Because as Long Islanders, I'm not in the restaurant business, I'm not in the bar business, but I would like them to be here when we all reemerge again and come out to, if there's ever going to be a normal life, because a lot of them have already disappeared. There's a couple that,
of course, but again, it's good
to
see that you've been doing a lot of good work on, like you said, advocating for those businesses. And I know also, I just did want to mention, I know that you announced this week that there was going to be a new, not specifically related to businesses, but for survivors of COVID, a free virtual support group. I know that your office is, again, working with, I think, another agency in the county to, kind of enact, and just seeing, trying to be there at the point of contact with different needs, whether it's, like you said, in the community for business, or like we said, mental health services, veteran services, whatever it may be. There's a lot there, but thankfully, it's good to have people who are keeping their eye on the ball. And hopefully at some point we'll be able to speak with you about other things besides just COVID. And I know, like you said, things like there was a big environmental announcement. There was a big amount of funding. And I think a contractor was announced for an environmental project that you were speaking about over in Nassau County with water quality issues, kind of ramifications, and also some bus terminal upgrades and all this other great stuff that, unfortunately we just don't have time for, because rightfully so, we need to kind of focus right now on where we're at. So thank you again so much for all your time.
Yes.
Absolutely. If you invite me, I will come back and talk about anything. So
we will appreciate it.
Thank you.
Look forward to it. Take care again.
It's a deal. It's a deal. Take care.
Have a good day. Have a good weekend. Stay safe.
All right. You too. Happy Thanksgiving, everybody.
So, I think that was good to hear. What was that? Boostnassau.net she was talking about?
Yep. We will get that info. We can share it on our social media. You can obviously follow her as well, I believe, at Nassau Executive on Twitter, and on Facebook. You can find her also, and all your social media platforms. I know she's had some posts about that specific thing. So it's interesting to see. Time has kind of flown, or whichever you prefer, Bill, since the last time we spoke with her with the county executive. And it's interesting to see that you don't want to have too much of that Groundhog's Day effect, but I feel like a lot of that conversation is similar to where we were before, but now it's just do we take a deep breath here and we do everything, and we can kind of, like you said, stay the course that we might be potentially on, or is it just kind of a natural progression that we wind up back to where we were in the spring of last year, as we see in now places like Texas and Utah and other places that didn't have that wave. It
seems to be a problem in convincing people that this is effective. I think New York was the the experiment, since when we got hit, the rest of the country was looking at us going, they wanted to put up the crosses and put the garlic on the border so we would, the vampires won't come over. But what did we do? All we really did was put masks on, and the numbers went down. Yeah,
I mean that, and knowing that different kind of interventions, medically and stuff like that, just kind of learning and having that open source kind of conversation and really trying to be adaptive and not just kind of stuck in a box. Again, we can do things that make a difference. But well, I was thinking before. I mean, it's not irony, but it's imagine if the people that didn't wear the masks were the ones that got the disease. But that's not what's happening. The people that don't wear the mask may be healthy; they may be fine, and they're affecting people they don't even know. Yeah. If it was the case that if you didn't wear the mask, you got the COVID. How many people do you think would be walking around without masks on? No, exactly. I mean, like you said, it kind of goes to your own biases and in terms of if it's a self-fulfilling prophecy that, like you said, it's not going to impact you, then it kind of reinforces your argument of, oh, well, see, I'm fine and it hasn't happened to me. But exactly. I think the big thing is now, as we're seeing nationally, the numbers being as high proportionally as they were for New York. And you're seeing now stories in smaller towns where, unfortunately, these, we'll call them temporary, like morgue, basically kind of trailers are being kind of called into action. Yep. It was somewhat easier. And I had friends who were traveling during COVID. They were trying to do this like massive out west, road tour and do all this stuff, all that point being is that, they were in towns. They were like, I don't know anyone from New York. Like, this is not a problem for me. Like, we're in, Billings, Montana. We're in, somewhere in Utah, wherever in Colorado. I see that it's bad for you guys. I feel for you. But it's like as if you're watching a hurricane, it's somewhere not near where you live, or if you see something in a different country and you're like, oh, you have a little bit of empathy and you feel bad. But you're like, oh, okay, that's not really something that I need to worry about. But now I wonder if, because it is for a lot more people, again, across the country in these different states, where will it change more? Will it, hopefully show people that, we don't want this to be an all hands on deck, not just in one or two states, but in all 50 states, because then you can't call people from another state to say, hey, please help us. Please give us the ventilators, what you're not using, because sorry, everyone's using everything. So, right. I don't know. And I mean, what the county executive said, at our peak, we were at 2,500 patients, I guess, a day. I mean, I guess that might have been like the floating number. Like a floating number? Yeah, of like where they kind of copped out the peak at, Right. But, so we were down to 20, she said. We are now up to 112. Yeah. I guess as of yesterday. A lot of that's happened fast, too. So I think it's, watching the trajectory, but also watching the rate of rise, So seeing, that's the thing, where when it becomes overwhelming, that's when it becomes a problem, because now you have all these people, who are trying to get maybe tested or trying to get access to resources, but now there might be a backflow, and all of a sudden, even a day or two, if you're not getting tested, now if you're not quarantining properly, what does that mean, for the other people around you? Yeah. So, well, I think in some respects we could call this the perfect storm, and because of the political atmosphere, we've got two sides fighting about, and mostly what they're fighting about are things they don't know anything about, which is why they're fighting in the first place. How many people didn't know the way that the votes were going to work this year? So all of a sudden, mail-in votes that arrived the night of the election are found votes when they were never lost votes. They were votes that were in the mail that either arrived at a polling place or they were there and yet to be counted. So we've got all of this going on, and this all of that BS, I guess if you'll call it, is affecting our ability to handle a pandemic, because it's flowing over into the discussion about what we should do, about wearing masks and about, I mean, sometimes, and even the last time we spoke about this, how these rules could seem arbitrary. The biggest one that I've seen as far as the blowback from is the 10 p.m. curfew thing, as though
you're only susceptible after 10 p.m. and
Yeah.
before 10 p.m. you're okay. Those are
that's the joke that
kind of goofy things you read about
at night. I mean, I get the problem is the rollout about it because and I know they are sending people to go out on the media and try to talk about why they want to do that. But I don't know. Again, like you said, it seems a little hollow on a lot of people's ears. But at the same time, it's not necessarily the 10 o'clock blanket statement, but it's certain facilities. If you have people continuing, I guess, staying into the night late, inhibitions get a little bit, kind of more relaxed in a bar or something like that. I can see, why they capped it at a certain point. But if it's 1 hour difference, what does it really mean?
Right. Except that they do one of the ingredients in the equation that would figure out your susceptibility or, is how long you stay exposed in a certain environment.
Yeah.
If you're going to a restaurant or to pick up your food and you're leaving, your exposure is minimal. Yeah. But if you're going to sit in that restaurant for 5 hours nursing drinks and coffee after dinner, and you're exposed, that line is going up as far as the graph goes. Your exposure is increasing as you go along. I mean, a lot of these places have done things with air filtration. So they spent money doing that. They spent money putting up partitions so people wouldn't sneeze on each other. Waitresses have glass, doodads on their faces. So, that was a lot of preparation and a lot of work.
Yeah.
And now it's kind of, none of that matters. We got to do this. He may be right. I think we have to do something because if we go back up to that 2,500 number, what you said before is right. We won't be able to ask another state because now they're in the same boat that we were in months ago. Yeah. And if the whole country goes that way, it has a lot more ramifications than just people getting sick. And
no, you're right. I mean, think about what it's done, already, like you said, to other elements of our daily life and, our mental health, like you said, our economy. There's so many just kind of effects that are related directly to it. And that's why I understand this debate. And I know we had this article that was written in Newsday talking about, they were just interviewing medical experts and discussing restrictions. Should they be more tight? Should they be more lax? Again, obviously, medical professionals tend to agree that, we can't kind of err on the more kind of relaxed side. We want to make sure, if anything, you're overcautious versus undercautious. But at the same time, it's a hard thing to sell to the average person, the average constituent, the average voter at times, as we saw with the election. But, just the average person, it seems like you said, that a lot of people get the COVID fatigue, and
right.
That's why I was hoping, in the summer, it was a little kind of a breather. I kind of took it that way. I don't know about you. I know some people kind of still stayed a little more hunkered in, but I know in the spring, I was, pretty not obsessive, but, being very, very cautious, I'd say, more than I was during the summer. And now that I see that it's kind of rebounding, I'm starting to maybe pick up a little more of those habits, make sure I spray the doorknobs a little bit more, or, do certain things that, I just kind of feel at least that I have some sense of control in, and trying to keep me and my family safe. So I think it's not about stigmatizing things. It's about kind of saying, as long as it's something that doesn't hurt and it's working for you and it's working, in aggregate, then that's what we have to kind of be leaning towards.
Yeah. One of the other things I wanted to address is that idea that people talking about, I think the last number when I read it was 230,000 people have died from COVID. Yeah. And then, of course, the swamp that is social media. You read people saying, but only 4% of those actually died from COVID. The rest had underlying conditions. Oh, okay. So now we're going to separate out the numbers and say, this guy actually died just from the virus. And these guys died because he had a heart disease or he had. The point that they're totally overlooking is that man with heart disease has lived with that heart disease for 30 years.
It never became, it didn't become acute until now. Had he not
gotten COVID, he would still be alive.
Yeah.
So yes, he's a COVID death. I get tired of this nitpicking BS, and conspiracy theory garbage that is one of the main reasons people just won't wear masks.
Oh, yeah. No, there's a certain segment of the population that no matter what kind of data you give them, I don't know if it's just on this or in anything, they'll always kind of see,
it seems to be on a few things. It seems to be.
Yeah.
True. Yeah.
No, of course. And I get it. I get, that, and we always talk about, information can be misleading. People can cherry pick things. People can, kind of try to portray it in a way that's obviously in their favor. But, it's a hell of a thing, after we saw everything going on with medical professionals to try to accuse them of saying, well, maybe they want to, boost their revenues by declaring something as a COVID, case for that reason alone. I mean, that takes a lot of audacity, to try to really be legitimate in saying that. But, that is something that we're hearing. And just I'll say real quick from the article from Newsday, it was written by David Olson and Matt Clark earlier this week. Just saying again, just for context, in hospitalizations in the statewide, we're at about 1,600 on Tuesday. That's up from about 1,550 on Monday. And it's about a 53% statewide from the week before. So that's the thing I think that it comes down to, like I was saying before, not just the pure numbers, but the rate. So if you can bring that down from 53% to 20% and keep lowering it, then we can probably stay ahead of it. But if it goes from 53% increase to 80% increase to 150% increase, and then it becomes
I also off the tracks. Very telling the way that you said it. We could stay ahead of it.
Yeah,
I don't think it's ever going away. It's always, or for the foreseeable future, it's always going to be a threat.
It's like a wildfire. It seems like in some ways, where it spreads up, it flares up. You have to do a kind of damage or a controlled burn or whatever it may be.
Yeah, right.
You have to understand that, we have to just have these preparations because it's part of life for now. And until, something is figured out long term, that's kind of the case as it's going to be.
I think, let me share that story that you were just reading from. I'm going to read some of that. By David Olson and Matt Clark. This is from November 11th, 2020. As the number of COVID-19 hospitalizations rises and the rate of new cases reaches record levels, in a few Long Island communities, medical experts say that the state should consider restrictions that go beyond the limits that Governor Andrew M. Cuomo announced Wednesday. The percentage of coronavirus tests on Long Island that came back positive rose to 3.47% on Monday, before slightly falling to 3.3% on Tuesday. That was after positivity rates below 1% in most of August and the first half of September. There we go. That's the in Kings Point and Harbor Hills on the Great Neck Peninsula, the rate of new infections per capita is now higher than it was during the region's COVID-19 peak in late March and April. The increased caseloads and hospitalizations are ominous signs, said Dr. Bruce Farber, Chief of Infectious Diseases at North Shore University Hospital and Long Island Jewish Medical Center. It will get worse, in my opinion, as it gets colder and colder and people spend more time indoors, where the virus spreads more easily than outside, especially as they gather for Thanksgiving and other holidays. I don't know if it's irreversible, but I'm not optimistic that the next few months are going to be good in this country, or that it's going to be as good in New York as it was. Cuomo on Wednesday ordered gatherings in private residences not exceed 10 people, unless more than 10 people live in a household, and that restaurants with liquor licenses, bars, and gyms close by 10 p.m. So the previous limit on home gatherings was 50. Get-togethers of 50 or fewer people have been a key source of coronavirus transmission, according to Cuomo. So restaurants, bars, and gyms also have been a primary reason the virus is spreading in New York, he said. Well, experts say the restrictions are likely to have little effect. The limit on gatherings does not apply to banquet halls and other businesses that host parties, even though we've seen they can contribute to super-spreading events, said Rachel Pitch Loeb, an associate research scientist at New York University School of Global Public Health in Manhattan, and a preparedness fellow at Harvard University's T.H. Chan School of Public Health. And Pitch Loeb said she's unaware of any studies that show that a 10 p.m. curfew for restaurants and bars and gyms reduces transmission. A better approach is to more strictly enforce existing regulations, which limit capacity of restaurants and bars to 25% in New York City and 50% elsewhere. Farber said limiting house parties to 10 people is better than allowing 50, but he said the virus still can spread when 10 people get together. And with the difficulty in enforcing those restrictions in private homes, it's basically guidance rather than a mandate. More likely than not, additional steps are going to need to be taken, such as extending the gathering limits to catering and banquet halls and considering a reimposition of the ban on indoor dining. Well, Jack Stern, spokesman for Cuomo, said the restriction on gatherings doesn't include catering and banquet halls because they must operate under a number of state COVID-19 regulations. And if they violate them, they are subject to enforcement from the state liquor authority, which can suspend their liquor licenses or fine them. Those rules include requiring masks when a patron isn't seated and prohibiting dancing and gathering together while standing.
Yeah, good luck.
I'd like to see movies of that wedding.
Dancing while in chairs.
Cuomo said during a press briefing Wednesday that new restrictions are appropriate at this point in time, but he added if those measures are not sufficient to slow the spread, we will turn the valve more, and part of that will be reducing the number of people in indoor dining. Yeah. So COVID-19 hospitalizations statewide increased to 1,628 on Tuesday, up from 1,548 on Monday. And the number of coronavirus patients at the 19 Northwell Health hospitals rose to 219 on Wednesday, a 53% increase from just a week before. Although that's a fraction of the peak of the more than 3,000 COVID-19 Northwell patients on April 14th.
Yep.
So the statewide positivity rate Tuesday was 2.93%, including hotspot areas that have more testing and higher rates. So more than 4,800 New Yorkers tested positive Tuesday, more than 10 times the number who were testing positives on some days over the summer, although fewer people were being tested then. And there you go.
Yeah. No, I mean, like I said, it's what we're watching statewide and, right here in Long Island, and there's a lot of similarity, and it's not for the better necessarily. Yeah. But it's interesting to see. Again, they have to parse out, like you said, does a banquet hall count? If it's maybe big enough, or if it's having an outdoor event. I
was under the impression that they were all closed anyway.
Well,
I didn't realize that under the state rules they could still have a wedding.
No, yeah, I believe again, not to my understanding in New York City, but Long Island, again, because some restaurants are open. If I imagine you kept within the capacity limits, it's a bigger space, then maybe it's something that is a little more manageable, especially if you're an outdoor, maybe a catering company, you could do an outdoor banquet or something in the summer. Okay, I can see it, but I did see in Suffolk County, the SLA pulled the license and fined, I think, a company. Yeah, exactly. But one of them I know was from a super spreader wedding that you see everyone. And again, it's a wedding. You can't expect people to be all, kind of like, tied up and not want to let loose a little bit and celebrate. But at the same time, if you're the one who is the business owner, you have to realize that it's going to come back and bite you, Besides the ethical part of it, of just wanting to keep people safe, just the nature of, you don't want to be the one that the press has to run the stories about, because now look what happened.
I mean, it can't be good for business, that's for sure.
No, doesn't seem to be. But I'll just segue. I know there was another quick story to the point of, like the SLA, trying to have oversight and making sure people are, kind of doing everything they can so that we can keep these infection rates low, so that we can get back to like how we felt in the summer, where we were a little bit doing a little bit more kind of, just kind of back of the mind versus front of the mind all the time stuff with COVID. I'll just mention that there was a story by David Olson, and that I believe is Dr. Olson, who was a Newsday reporter from a few days ago, and it was just talking about Long Island's. There were 3 healthcare facilities that were cited by the federal government for alleged coronavirus-related workforce violations, and they were given, fines totaling about $22,000. So it wasn't that much money, but I think still just the fact of, trying to bring attention to where there may be issues. I know.
I want to read the next paragraph after what you said. The alleged violations of U.S. Occupational Safety and Health Administration standards include not giving a medical evaluation to employees for the use of respirators, not fit testing respirators on employees, and not reporting a work-related death of an employee to OSHA within 8 hours as legally required. Interesting. So they're talking about the frontline workers.
Yeah. And OSHA, I know there's a lot of discussion about them at the beginning of this process where, when we're trying to talk about keeping everyone safe, the first line workers are, the essential, medical workers are the ones who are most likely to be impacted directly. So, yeah, you want to make sure that there's some kind of accountability, that those folks aren't there like they were in the beginning where they didn't have the proper equipment. They were using, ponchos and anything they can get a hand on, garbage bags. And it's like, you're in $1 billion medical facility and this is the best we can do, So, like I said, it's good to see that they are doing something, even if it's only $22,000. But I guess overall, there's a little bit more there. It just says, since the pandemic.
More of that story. The citations announced Friday were among 35 nationwide.
Yeah.
That involved alleged coronavirus-related violations between October 23rd and October 29th, with proposed fines totaling $471,337.
Mm-hmm.
So it's not just local.
No, and since the beginning, OSHA has given out about $2.5 million in penalties from about 179 inspections. And the most recent ones who were the issue locally, it looks like, were the Meadowbrook Care Center in Freeport, not too far from where we are with the radio station. And that was, it looks like, for violating the regulation, again, mandating those medical evaluations to make sure they were tested and fit properly, those respirators. And, there are some other places. It looks like Mercy Medical Center and Rockville Center was also initially given a proposed fine. And I think the third one looks like was East Northport Residential Healthcare Facility, which is also known as the Huntington Hills Center for Health and Rehabilitation, which is actually in Melville. So,
some of these got violations for different things. Again, work-related deaths are supposed to be reported to OSHA, I guess, within 8 hours. And
yeah, you would hope so. I mean, again, it goes back to, I know we've had that conversation in the past, but, the fact is that the fight for unions, the fight for labor rights in this country, and a history of employees, kind of a lot of times dealing with things, whether it was the black lung in the coal mine or, asbestos or whatever it may be, some kind of occupational hazard. That
the Mother Jones magazine, right?
Oh yeah.
That's Mother Jones came from the black lung. The miners. That's where.
Oh yeah, no, of course. And there's the history in New York. You got the the Triangle Waistcoat Factory, Waistcoat Factory, and all these types of incidents. Yeah,
I think and it's not kind of obvious. We're born into it. We get Saturday and Sunday off.
Yeah.
People don't realize that there were people that some of them died.
Yeah, the idea of
to get that benefit for workers. And look, we're still arguing. We're in the 21st century. We're going to argue about a $15 minimum wage.
Oh yeah, and
that would only serve. Would only serve to keep most of the people who will get that. It'll serve to keep them poor.
No, and the thing is, there still isn't pay equity. So you still have people who are putting their wrists on the line, and you have half the population doing it for still less rate than the other half. So it's definitely crazy. But I know that was a big thing. I think we talked about at the beginning of this. Well, what will OSHA do? Will they have teeth, or will they be defanged? Maybe even because of the administration potentially. In terms of enforcement. But it's good to see. That's a decent figure. I know it's hard to do a lot of this kind of accounting, especially while everything is a little bit more fluid. But it's good to see that at least. You don't want to see people do the wrong thing, but you don't want them to be punished just for the sake of, the angry mob, but so that they can correct it and that other businesses can realize we don't want to be, again, even if it's only $10,000, we just don't want to have the hit to our reputation,
sure.
Anything that stops us from doing it. So there was that. There's, obviously the ongoing conversation of, the economy bouncing back, which we spoke about a little bit before. I guess there was some other news too. I don't know. Do you want to go back to the economy story, or do you want to do LIPA, or do you want to talk about the latest updates on the elections? Probably got time for more quick.
Yeah, let's do the election update just for the heck of it.
Okay. Let's we can kind of following that along.
There we go. Absentee vote results still more than a week away. Officials say this was from November 9th.
Yep, Michael Gormley, and we're speaking with Yancey Roy the last couple of weeks, and. It's been an ongoing situation, and for people like me who are kind of politics nerds and, enjoy the sport of the season, in some ways it's nice because it's the extended kind of calendar and there's still a lot more returns to watch and there's more there this year, we'll say. But for the average person who just wants to know what happened, it is a little bit of suspended animation, but we're getting there. I know, at least just in New York City, they only started counting the absentee ballots, I believe, on Tuesday of this week.
Right, and some of those counting abilities were mandated by local
that's
governments.
What it is.
They were told when they could open, right?
Exactly.
Because people are saying, why don't you count the votes? And that's what I was saying before about the biggest issues are coming from people who don't know how it's supposed to work anyway.
No, exactly. And that's what, Yancey Roy was kind of alluding to, that, for folks in the know, again, this is something that you kind of anticipated and you understood that this is not going to be election day. It's going to be election week, at best. But for anyone else, I understand why you're like, well, is there something funny going on? But, because they just don't know what the normal procedure is. But that's a lot of voters. A lot of voters vote only every 4 years. They don't vote, in their local down ballot and stuff.
But think about it. More people voted this time. 160 million people voted.
Yeah, we broke that record. We
good for us.
Totally. But at the same time, with this year being everything going on, will we get higher than that? Because hopefully we will. But now, I wonder if this is the high water mark for a while to come. But either way, there's a lot to still watch. And like I said, I'm happy to have had a little bit of a firsthand experience just being a part of this cycle in our own kind of enterprises and things that we had to do here in my neck of the woods, but also now being a part of watching both for Queens, but specifically it is watching involved with the race with Swazi and just seeing how this process is and seeing again, just exactly what it looks like. It really is an amazing sight. Like I was talking to you and Sean about before. It looks like this surrealist poker kind of tournament where everyone just so intently watching what these BOE workers are doing, and they're moving the ballot across you. You all look at it, and you're just like, okay, yep, that's what you said it was. Yep, that's what it is. Everyone,
look, there's been no evidence of fraud anywhere. The only place we heard that from was from the White House. That was. And he's been saying it for 4 years. So
that's the key. Yeah.
In any event, let's say Michael Gormley says that the counting of more than 1.5 million absentee ballots cast statewide could begin as soon as Tuesday. But in practice, the sorting of the deluge of mail-in votes will mean many areas, including Long Island, won't see final results at least until the end of next week, election officials said on Monday. Yeah. The Nassau County Board of Elections hopes to begin counting Thursday or Friday, while the Suffolk County's election board won't start counting the paper ballots until November 16th. Suffolk County will begin its count with the 3rd congressional district race in the contest. Tom Swazi, Democrat from Glen Cove, trails by 4,185 votes against Republican George Santos. But there are 86,597 absentee votes to be counted in that race. Of them, 47,039 were cast by Democrats. 16,004 were cast by Republicans, and 20,121 by voters not enrolled in a party, according to the latest State Board of Election tally. Results will take days and could be announced when the count of each race is final or when all races are final. Those are among the issues to be settled in negotiation by the bipartisan boards of election in every county.
Yeah. And it's interesting, too, because the Swazi race, I think it's one of the only races or even election district that I'm familiar with, that they're actually having to review ballots in 3 counties because his district is a very oddly shaped one.
Oh, right.
Gets into the tip of Suffolk and it goes through Nassau into the end tip of Queens. So that's got to be an interesting process too. Seeing, and that's what we've been talking about, that how it's broken down and each BOE has to be responsible for the ballots cast, obviously, in its jurisdiction. So that's an intriguing one. But overall, obviously I can't, say much from that, too specifically. But I would say that what we're seeing directly, does kind of meet what that expectation is that Michael Gormley and them are saying in terms of where the votes are breaking with absentee ballots. It is heavily favoring Democrats as it was expected to, which is a whole nother topic. But it's definitely interesting to see, again, that, like I said, that we're trying to do as much as we can with the press, and with everyone to try to just say that this is normal. This is what we're doing. This is how you can feel confident again that your vote was counted. Even if it was a week later, you'd rather it be a week later and it was counted versus, we all tried to do it in one day. And of course, you have human error. You see now in Georgia, they're talking about trying to do a recount of the whole states for the presidential race in, I think, 8 days. And that does not seem
I think that, and I think one of the reasons for that, aren't there two senator
there's going to be two Senate races, but actually what we wound up discussing was it's actually not going to be a recount based on that particularly, because the threshold is so close that no matter what, basically they would have to go to a runoff by their state, kind of election, kind of policy. So it's interesting, but I can say over here, back to the Newsday story, that it looks like on Monday, because I don't think this was the case over here in Nassau, but it looks like in Monday, it was announced that Suffolk County did begin its 3% audit, which compares the tabulations of 3% of absentee ballots to hand-counted tallies of the same ballots. So basically, it's just another fail-safe method, it looks like. And then what they do is they're able to then do those comparisons, and they'll be able to make sure that all of their counting have been valid. So it's like another check, basically, on the system. So it's interesting to see those types of minutia policies, how the sausage is made in terms of counting votes in a way,
Well, again, one of those things that I feel compelled to constantly fight is this battle cry of fraud. I'm getting tired of hearing it. Yeah. Because my response to that is always, show me the proof. And nobody can. The Trump administration has been kicked out of court already 10 times because once they get to the point where the judge says, give me proof, well, they have to admit there is none. The Attorney General of the United States has the prosecutors across the country out there looking for voter fraud, which doesn't exist. This is ridiculous.
No, and that's what I think, the county executive was talking about, that it's not just, you have like 80 Republicans and one Democrat, or 100 Republicans and one Democrat. You have equal members. They're all sitting there. Again, everyone's being civil. Again, for the most part, there was a couple of things that were a little passive aggressive, at least I'll say. But overall, everyone's there just trying to do their job. You're trying to cooperate, and you just want to make sure everything's done above board and, like I said, the right way. And I know I was just reading in here. The quote says that they're counting from 7 a.m. to 7 p.m. So a lot of these places, they're doing 12-hour shifts, and it's a lot. And, we'll just leave folks with just, again, I know we talked about what the national levels, what national amount totals of votes were, but in the state, it wound up being that there were 2.4 million ballots that were actually requested, and 1.56 million have been received so far. And that's including almost 495,000 voters who applied for absentee ballots. So, like I said, we can pat ourselves on the back a little bit.
All right. Yeah. All right. Well, we're running out of time very swiftly. So I just wanted to say to the listening audience, because we're going to have some schedule changes in the next couple of weeks, and I don't know how many times we're actually going to be on.
Follow us, though. You can find out on social media if you want to follow us on Twitter at TWLIN News, also on Facebook or on Instagram.
Okay, we will be on next Friday. I just got notice of that. Okay, so that's good. We'll be here next Friday.
Exactly.
But anyway, we want to have a great weekend. And, of course, John, thank you for being plugged into all that stuff. Go rest your brain a little.
Something like that. But appreciate it, Bill. Thank you again, as always.
Take care, folks. You're listening to 90.3 WHPC, the voice of Nassau Community College in Garden City, New York. Bill McIntyre and Jon Gallo signing off. Take care.